At this time, I'd like to entertain any questions that anyone may have.
James Causey, Journal Sentinel. What will you do next? I mean, what will they start doing? Will they start going out offering free testing? What will it look like in the next 48 hours?
Well, I'll have Ms. Coley speak to that, but let me say, being in the position to reach populations quickly, to engage them is important. We have important events that will be happening this week in our community, starting with Pride Fest. Diverse and Resilient will be at Pride Fest, as will I, and I look forward to some of the strategies they put forth. An increase in testing and outreach. There has been an increase in testing in Milwaukee, and that's why we've been able to identify some of these trends, but there needs to be more of that. We will need to look at treatment capacity and screening capacity in our city, but we need to focus on stakeholder groups. And I think in the next several days, it's important for us to have those discussions and to convene those groups where the stakeholders have the position to move things forward. I'm in discussion now with many of the stakeholders in Milwaukee, and then there will be convened. And it's the stakeholders and the community at large and people who have HIV, people living with AIDS, who are going to make some of these important decisions to help us curb the spread of HIV. This is not something for the Milwaukee Health Department or Diverse and Resilient to do alone, so we have to do that. I'll have Brenda talk about some of the things that they'll deploy in the next 48 hours.
Actually, we had a training last night of 44 members of the population to become health promoters at Pride Fest. So they will be working at Pride Fest to do testing promotion. They'll be engaging members of the population, some people that we only see at Pride Fest, to come and get tested during that time. We'll also be holding 2 HIV forums to roll out the plan, to talk about how members of the population get involved and stakeholders can get involved as well. So we're having this highlighted at Pride Fest, that this is something that's happening in our community and it takes a community response in order to resolve some of these issues. So we're on the ground running tomorrow.
How does the 140% increase compare with the rest of the cities in the U.S.?
Well, this is a trend that the Centers of Disease Control suggests that they're seeing in other urban communities. However, the spike in Milwaukee was significant enough over a 6 to 8 year trend that it required even more focus. We don't have all the answers, and that's the need for more community participation and stakeholder response in both the state and the city to work with those individuals. What we do know is that this is impacting our African American community more than any other community, and we need to be very candid about that. What's happening in other major cities is important as we look at global transmission, but what's happening in the African American community in Milwaukee is primary, and that's what we must get to the root cause. It will require all stakeholders, all community groups who are currently working with people of color to be in the room at the same time to come to this. So we're going to look at cities, other big cities similar to Milwaukee. We will look at what their best solutions are. We'll look at what their problems are. But this needs a Milwaukee solution for a Milwaukee problem, and it needs a solution where it impacts the African American community both favorably and long term. Other questions or comments?
How do you take it? I write about this issue a lot, but it still keeps coming back to being the gay disease. How do you take it beyond that conversation?
Well, I think the way we take it beyond that conversation is to be truthful about the fact that Milwaukee has communicable disease concern. It is not just HIV that we are dealing with on a daily basis. We have also higher rates of chlamydia and gonorrhea. HIV transmission can impact anyone at any time, anywhere. And certainly, while those that are in the gay, lesbian, and transgender community have been impacted, we understand that those who are in other sectors of our society can be impacted and will be impacted if we don't curb the spread of disease. This is not just about individuals who identify as being gay, lesbian, or transgender. This is about the safety and welfare of human beings who we care about in the community. And we have to address this. Unless we do that, we will be in a world of trouble in the city of Milwaukee. Well, that being said, I do thank you all for being here today. I do hope that you will be engaged. We will identify additional tiers for our plan. There will be community partners that you know very well who will be convening very soon. We will also look at sources of funding, both locally, statewide, and federally, to address these statistics. It is one thing for the federal government to list Milwaukee as a growing concern. It's another thing for Milwaukee not to receive the funding for HIV and AIDS that other communities around the country currently get. I will advocate tirelessly for Milwaukee and Wisconsin to receive its fair share of HIV and AIDS funding. And I will advocate for the African American community to get its fair share of culturally sensitive and culturally competent care to approach this community. I thank you very much.